Hello and welcome to the aggregation of marginal dental gains. This is where I talk about 1% improvements all over the place can added up equal large gains. Okay, and actually this was started back in about 2003 by the British cycling team coach Dave Brailsford. And Dave Brailsford was hired to bring the British cycling team into notoriety again. They hadn't won any medals since like 1908. So what Coach Brailsford did was he broke down cycling into as many different pieces as he could possibly do. And then he improved everything like 1% and then added them all together. And then they ended up winning so many awards and stuff. They set 9 Olympic records, 7 world records, 5 Tour de France victories, 178 world championships. This is what I want for your dental health, or your oral systemic health, since dental health is linked to systemic health. And this is the math behind the 1% improvements. 1% better every day adds up to 37.78 times better if you do it every day for a whole year. And if you do things 1% worse, screw up every day, you'll decline down to practically zero. Now, these are some of the improvements that make my method of toothbrushing better than other methods. I start off with squishing and swishing the toothpaste. This has a lot of benefits, because first of all, toothpaste doesn't go between teeth very well at all, really. And when I do fillings between teeth, 99% of the time I find the decay starting about the middle of between the teeth where the teeth touch, and it extends like it's been windswept or blown lingually toward the palate or tongue. And I have to always extend my cavity preparation lingually further than I want to, because decay almost always goes further toward the lingual. And this is because when you brush your teeth, generally the normal way, all you're doing is scrubbing on the facial surfaces, and the toothpaste gets pressed in between the teeth only to the point where the teeth touch, and then it stops. And most people don't brush the lingual surfaces, so the linguals hardly ever get any real cleaning, and then they don't floss. Okay, so cavity starts about midway at the contact and goes lingually and toward the gum line too. Okay, another thing is for squishing and swishing. It's my version of a research that was done a couple of years ago. And what they did in this one research report was they found out that if you flossed first and then you brushed, you got a lot more toothpaste between your teeth than if you had just brushed your teeth. And I've actually been squishing toothpaste between my teeth since I was about 10. And then I started flossing that toothpaste between my teeth too. And that, I think, has been the main reason I haven't had any cavities since 1982, I guess. When I started dental school, I think I had one cavity that I let somebody fill, and then another one I let somebody do a crown because he needed some credits. And I thought, well, I want to experience what it's like, so I did that. After that, that's basically it, except for I broke 5 other teeth in the last 30-some years. If you have sensitive roots and you just brush with the desensitizing toothpaste, that's not good enough. It has to kind of soak around the teeth. And my way of squishing and swishing gets on there pretty well. And you can see the damage done to the sides of teeth where toothbrush abrasion occurs from people putting the toothbrush wrong. And we went over the lateral jaw shift, where you move your jaw sideways, and then brushing at a 45-degree angle. That's not really my concept. That's somebody else's a long time ago, Dr. Bass. But I modified it to being like 45 degrees to the vertical for the insides of the mouth. And it works really well if you use the type of toothbrush that has bristle kind of longer on the end of it, like extended bristles on the tip, not just totally flat, but extended. That way it gets under the gums better and along the curvatures of the teeth. And then for the lower anteriors, I like to think of it like this. When your paint can is empty, you still have a lot of paint on the inside wall of your paint can. So if you were to rub your brush around in the inside wall, you could still get some more paint. Well, the lower teeth on the backside toward the tongue, that's like your empty paint can, and you have to brush the backs of that to get that plaque off of there, which is like the rest of the paint. Okay, you get the picture. And then my method of doing it is highly choreographed, like ballet or martial arts. It starts in the upper right, goes around to the midline, and then to the upper left, and then swings around to the inside left, and then around to the inside upper right, and then down, around. And it's very fluid and requires minimal effort to do it. So it's kind of like those martial arts fight scenes where every move was connected to the next move. Additional recommendations: do it in the shower. That's your dental fitness gym, the shower, so that you can make a mess and not worry about splattering a mirror and getting your clothes messed up. You should strive to do the reuse oral method of brushing every day if possible. But if not possible every day, try to do it at least every 3 days, because studies show that within 3 days you start getting microscopic evidence of gingivitis forming. And so I like to think of it as working out. Maybe you can work out really hard a few days a week and then sort of do an average workout the other times of the week. And then you take a day off or two in between, and you do different exercises on different days. That's more into the renews oral method further in my course. But if you can't do it every day or every 3 days, at the very least, try to do it every day for 10 days before your next dental visit. That's because if all you have is gingivitis and some plaque and not any tartar, you can likely sort of reverse that by the time you get to the dentist and probably avoid some extra charges. Otherwise, a lot of times dentists just take a quick look and go, oh my God, do they know which end of a toothbrush to use, or do they even know what a toothbrush is? There's more to this than meets the eye, because brushing is just the tip of the iceberg. There's a whole lot more, like interdental cleaning with floss or toothpicks or floss picks or water picks. And then there's after brushing, what you do. And then there's in the daytime what you do between meals. And it's different when you wake up in the morning versus when you go to sleep at night. How do you do your teeth at night? There are a lot of things that are different. How do you do it on vacation and so forth? And then since you've killed a lot of germs, not all of them, you don't kill all the germs, okay? You can't kill them all. They won't all go away. You got germs hiding in your sinuses and on your tonsils and your throat and back of the tongue. So anybody that thinks they can get rid of 99% of germs, that's not true. But you have killed a lot of germs in the mouth. And what you'd like to do would be to possibly repopulate with good ones instead of leaving it up to chance. Now, there are some people who promote all this stuff to kill so many germs, but then they have no strategies to repopulate. It'd be kind of like if you take a bunch of antibiotics for some sort of an infection and you get the runs and you're on the toilet forever, right? And then you just cross your fingers when you're done with your antibiotics that you're going to somehow magically have your gut repopulate properly. And maybe it will, maybe it won't, maybe it'll take months, who knows. But if you took some probiotics, or if you ate some yogurt, kimchi, kombucha, things like that, you could repopulate your gut a lot faster. In fact, the best thing you could do while you're taking your antibiotics would be to eat yogurt and take probiotics during the time you're taking your antibiotic, so that you can help to renew your gut bugs properly as soon as possible. And you could do pretty much the same thing for your oral health with Breathific dental probiotics. These can work overnight to help repopulate your mouth with good bacteria and fight bad bacteria while you sleep safely, because they're strips and they stick in the mouth discreetly and dissolve over about 6 to 8 hours. So thank you for watching, listening, and so forth. I have a lot of places where you can find me. There's a partial list of everything that I'm doing. And I encourage you to just follow me somewhere along the line and learn more. Okay? Thank you very much.